You're watching CreekBox TV.
Good evening, everyone. Welcome to CreekBox TV. I'm Alan Hanley, and today we have four lovely young ladies with us from Clinch Memorial Hospital, and they're going to be talking about the COVID virus. We have Miss Marcia Nelson, Miss Katie Rowe, Miss Kelly Register, and Miss Jessica Sloan. So before we get started, I'd love to tell us what y'all do at the hospital. And we'll start down there with you, Miss Marcia.
Okay, my name is Marcia Nelson, and I am the laboratory manager.
My name is Kate Rowe. I'm a wound care nurse practitioner. I'm also a director of employee health and infection control.
I'm Kelly Register, and I'm the chief nursing officer here at the hospital.
My name is Jessica Sloan. I'm the director of nursing.
Thank y'all so much for coming on CreekBox. Y'all do a lot for the community, and man, we appreciate y'all taking the time. You know, it seems like we thought we were over COVID just a year ago, but now it's come back stronger than ever. What makes this one different than the last one? And that was going. Miss Jessica, do you mind answering that?
Yes, what makes this one different is the symptoms are a lot milder. So on top of the mild symptoms, it's also easily transmissible to everybody. People are seeing people that have the vaccine also get this virus as well because it's so easily transmitted.
Now, some people said they didn't have the vaccine. Now, does that make them get more sick this time by not having the vaccine on this one, or is it about the same?
It's about the same.
I got you. I'm going to give you another question, Miss Jessica. What symptoms are you seeing in the virus? You know, I got a buddy that he didn't even know he was sick till he went and got tested.
Some people aren't seeing any symptoms at all. Others are seeing your basic common cold type symptoms: cough, shortness of breath, fever, chills, sore throat, runny nose and congestion, nausea and vomiting.
All right, Miss Marcia, you are the lab director. Tell me about the availability of COVID tests. Are we running low or?
Right now, there is a nationwide shortage because the testing has increased to such great numbers. We are doing everything that we can do to keep supplies in-house, but it's not just with us, it's everyone. So part of trying to conserve supplies that we have on hand is to be careful in the way the tests are ordered so that we can make sure that the ones that need to be tested, the tests are available to test. Because we also use Mayo Clinic laboratories if we have to refer tests out, but then that creates such a great cost, so we definitely try to limit that so that we don't go through our resources unnecessarily.
Yes, ma'am. All right, Miss Kelly, you say there's a shortage of supplies, so what should the community do to help prevent and misuse the test?
Like Marcia said, there is a nationwide shortage on the test. But the things that we're recommending that the community do is not misuse them and don't abuse them by getting excessive testing done. We recommend that everyone follow CDC guidelines. For example, for exposure, if you're exposed to someone with COVID-19, the guidelines are not just to go immediately and get tested. You can actually get some false negatives that way. So what they're recommending is if you're exposed to someone, you self-isolate for 5 days from your last exposure to that person. And then after that, 5 more days of strict mask adherence. And any time during those 10 days, if you develop symptoms, then you are to get tested. And that kind of helps us. For example, if you're exposed, you get tested on day 1, no symptoms, and then 3 days later you develop symptoms. So you get a second test. So we've, in a sense, used 2 tests when we really could have only used 1.
I got you. That makes sense. So, Ms. Kelly, are the tests free to the public?
Technically, COVID-19 testing is free, but we are able as a hospital or healthcare facility to bill your insurance. And with most insurances, they do cover the cost at 100%. But there is some misconception when it comes to presenting to our emergency rooms. For example, if you come to the emergency room for a COVID test and you have symptoms of COVID, you'll get charged for an emergency room visit. You'll get a provider charge, and then any other test that provider feels necessary. For example, if you have those flu-like symptoms, you may get tested for COVID, get tested for the flu, strep, and anything outside of COVID you will get billed for. So we just want the community to know that utilizing the ER, there are additional charges that you can incur whenever you come to our emergency room.
Now, darling, does the hospital get reimbursed for any of this? Other than the insurance?
Yeah. Well, we do get some funding, but it's minimal. But like Marcia said, when we have to go through our resources, we do utilize Mayo Clinic, and at that cost, we do get excessive charges for the tests that we send out. And the hospital has to absorb those with minimal to little reimbursement for those.
Man, over the last year, there's no telling how much money
Yes.
that the hospital has spent on testing.
Yes.
I mean,
Well, in the past, especially whenever the COVID first started spurging so high, we were looking at Mayo bills between $40,000 and $50,000 a month that the hospital was still responsible for paying. And as the numbers increased, then obviously so did our cost.
And to kind of combat that, we have partnered with some additional resources in the community. For example, the Department of Public Health. We've partnered with them, and they come and set up on our facility property in the front parking lot every Tuesday from 8 a.m. to 3 p.m. to do free COVID testing. Keep in mind, this is completely separate from the hospital, so they do their own testing, reporting of the results, and we don't have any affiliation with that at all. But we just thought that was an additional resource that we could provide to our community.
yeah, that's great. Ms. Jessica, some people say that testing can be abused. I mean, what does that mean? Just coming over and over, every time you get a runny nose, you're coming up and
Yes, that's part of it. The other part of it is people coming because they were exposed to somebody, but they have no real symptoms of COVID. There's no cough, no runny nose, no congestion, no anything, and they just want to be tested.
yeah, I think that's probably half a harm. All right, Miss Katie, what are you seeing in the community as far as new cases and the infection rate?
Well, we've definitely had a huge increase in cases just within the last month, I'd say. Whereas before we were seeing maybe like at the beginning of December, I was kind of looking back at numbers, we may have had like 10% of our ER visits that were COVID related, not necessarily positives. But within the last couple of weeks, I mean, just today, 50% of, actually it was more like 80% of the individuals that we saw in the ER, they were all COVID-related symptoms, and 50% of those were actually positive. So huge jump in numbers. We're seeing less flu, much more COVID.
Well, now, will that cycle through eventually, darling? I mean, when you get it, I mean, when you re-catch it, I mean, is there a gap where you can't get it within a month?
I mean, not necessarily, but it's kind of difficult to answer that question just because of testing. You know, if you would go and test maybe a month or out, I mean, there are some individuals that are still testing positive a month out. Doesn't necessarily mean that they're infectious, they're contagious, and they're going to spread it, but you still have some degree of that virus circulating in your body. So that those tests are, I mean, they're not entirely accurate.
That's right.
in that regard.
That's right.
And you also have different variants that are coming along. So just because you had one variant doesn't necessarily mean you're immune to contracting the other one. So things are ever changing daily.
And see, that's around our community, a lot of people, you know, well, there comes, so this is going to continue. I mean, I know y'all don't have a
We'll
timeline.
always, well, I mean, I think we'll forever have our little surges.
I got you. And it'll be different from the last one. It'll
Yes.
change.
It'll
just-
constantly evolve.
Looks like we're going to have masks for a while. Ms. Katie, we understand that the quarantine guidelines have changed again. And this has made some people in the community frustrated. Can you elaborate on the new guidelines?
Sure. I mean, I know that, you know, as humans, it's frustrating when we're trying to care for ourselves, keep ourselves safe. We worry about our families, and that can be frustrating when you're trying to, you think you're hitting all the points, and then they come out with something new that, oh, okay, you got to do this, or no, we're going to rein this back in. So, I mean, I realize that that's super frustrating. However, the current guidelines, they've kind of shortened that quarantine window to about 5 days. If you test positive and you are asymptomatic and you remain asymptomatic the entire time, at the end of that 5 days, they just kind of want you to step back, take a look at yourself, pay attention to your body. If you've remained asymptomatic, you are kind of ready to get back to your life. You haven't had a fever, you haven't had a cough, nothing. They want you to be able to get back, you know, to your job, to your friends. They just want you to stay safe, you know, continue masking and that sort of thing, just like you would normally do. You test positive and, you know, you become symptomatic, like Kelly was kind of referred to. Maybe you had an initial test that was negative, but then you know, developed some symptoms and then you became positive. Again, from, you know, 5 days of that, you know, starting the symptoms or even having a positive test, You want to kind of step back. Are my symptoms getting better? Has my cough resolved? Have I not had a fever within 24 hours? And if not, then again, maybe let's get back to your life, go back to work. But just kind of be a little more strict with your precautions, good hand hygiene, masking, continue social distancing, within reason, no large groups, that sort of thing, close contact for another 5 days. So you actually get a 10-day window of, really protecting yourself.
Yes, ma'am.
The third part of that is if you become positive and your symptoms just don't get better, at 5 days you're, hacking and you've got a fever and it just doesn't resolve, you want to continue isolation for a full 10 days and then kind of reevaluate at the end of that 10 days.
So this isn't just like I said, I mean, it changes from person to person. It could be 3 days, 5 days, 10, 15.
Absolutely.
And I think a lot of people don't understand that. They think after 5 days,
you're ready to go.
Yeah.
And that's not what they're saying. That's not what we recommend either. If you are sick, you need to be at home.
Yes.
That's right. Ms. Kate, any advice regarding testing for employers?
Yes, there's been a lot of discussion within just the last couple of weeks. We've had a lot of employees, not our employees, but in the community, want to come and get rapid tests. And their employers, a lot of them are requiring that before return to work. The problem with that is, and we've kind of touched on that earlier a little bit, are those false positives. That test still kind of picking that virus up in your body that's circulating. It doesn't mean you're contagious. You're perfectly fine to go back to work. I think that's where we kind of recommend that employers kind of step back and kind of reevaluate their policy. And pay attention a little bit more to the employee's symptoms. If they're still sick, make them stay home. But if they are not sick at all, never had a symptom, then maybe they are ready to come back to work. They don't need a test to say, because it doesn't indicate how infectious you are.
That's right.
So,
Ms. Jessica, what are the visitation guidelines at the hospital now? I know, we had some back at the last wave, now this wave.
So right now, our visitation policy on our floor is 2 visitors per patient at a time. You have to be masked when you go to the patient's rooms and while you're in the patient's rooms. We limit the time because of COVID right now from 11 to 1 and then 4 to 6:30. Our ER can have 1 visitor through the duration of the visit there. But again, these are subject to change depending on what happens.
Mm-hmm. I tell you what, y'all do such an outstanding job. It means so much to our small community and just rural Georgia in general. Y'all have been the big heroes in the last year. I know that I'm sure you're tired. You've worked so much. And again, we appreciate y'all taking the time. And I'd love to have you back in a month so we can revisit some of these numbers and talk some more. I'll get with Miss Lily on that and she can hook us up. But Miss Marcia, we appreciate you and Miss Kate Rowe, Marcia Nelson, let me get all these names, Kate Rowe, Kelly Register, and Miss Jessica Sloan. God bless you and thank you for coming on CreekBox.
Thank you.
Thank you.
You're watching CreekBox TV.